Hello, Dr. Bradley and fellow students. My name is Eris Van Bibber. I'm a recent graduate of Kaiser University's psychology program from Tampa, Florida, and I'm also a retired military instructor. This week we were tasked with comparing and contrasting a current informed consent form and how it compares to the regulations set forth by the ACA Code of Ethics. I'm referencing the Journal of Mental Health Counseling for this particular section, and it states since 1991, the use of written informed consent information in counseling has increased substantially. It has been shown that using written forms may decrease the likelihood of malpractice suits being brought against mental health counselors. Furthermore, studies found that only 28.8% of practicing therapists were using written consent forms. When asked why they had chosen not to use a written form, several respondents stated that they believed such procedures either would hinder the therapeutic relationship or would actually be counter-therapeutic. However, this belief has not been substantiated by recent research on informed consent. Indeed, empirical evidence suggests that the opposite may be true. Written forms may enhance clients' first impressions of MHCs, which in turn may produce the benefit of increasing the likelihood that MHCs will have a positive therapeutic influence on the client. Informed consent is a process allowing patients and healthcare providers to make decisions together when more than one reasonable alternative exists. Accounting for patients' unique preferences and priorities and the best sufficient evidence available. So, informed consent is required for many aspects in healthcare. They include treatment, dissemination of patient information, discussion of HIPAA laws, specific procedures, surgery, blood transfusions, and anesthesia. Obtaining informed consent is a process that should include describing the proposed intervention, emphasizing the patient's role in decision-making, discussing alternatives to the proposed intervention, discussing the risks of proposed intervention, eliciting the patient's preference, usually by signature. Several exceptions to the requirements for informed consent include the patient being incapacitated, life-threatening emergencies with inadequate time to obtain consent, involuntary waived consent, and if the patient's ability to decision is questioned or unclear, an evaluation by a psychiatrist to determine competency may be requested. Next, I'm going to talk about Christian counseling at True North. This is the place that I decided to pull a informed consent form from and compare it to the ACA. True North is a Christian organization, and I wanted to take a look at how they were going to set up their informed consent. As I looked at it, the True North informed consent form has a brief introduction, and then it goes into the modalities of counseling, which include type of service, confidentiality disclosure, diagnosis, insurance, intention of harm, HIPAA, appointment, payment, and emergency accessibility. So they cover everything that the ACA Code of Ethics is looking for. So when comparing them, it met the requirement. Next, I pulled up my own state's requirements from Prisma Health in South Carolina. And in South Carolina, the rules are more stringent here. It goes to say the law is more stringent than the federal regulation with regard to informed consent. In South Carolina, the doctrine of informed consent is established by case law and not by statute. The controlling law of informed consent in South Carolina derives from the case of Hook versus Rothstein from 1984, as well as from a long line of cases that have followed, and requires that the treating physician will be the individual who must obtain informed consent from his or her patient prior to initiating the diagnostic, therapeutic, or surgical procedure. After comparing the different informed consent forms, I found that all of them meet the requirement set forth by the ACA, and that the state that I reside in is a bit more stringent with their guidelines. As a student or as a counselor, it would behoove one to know that each state may mandate different obligatory sanctions with informed consent. So it would be paramount for you as a counselor to definitely know how your state is going to regulate that informed consent form. Thank you all, and God bless.